Good morning, very, very highly distinguished members of this office.
एडिट नहीं होता है वो बोलना कहाँ से करते
us in this wonderful forum. And I really like the greetings also from Dr. Jagdish Prasad, Director General of Health Services of Government of India, who was also keen to come, but for certain pressing needs is not able to come, and I really have the privilege to represent him in this August gathering. But dear friends, this is really a delighted moment for us that we are sitting together, and the health of our people of our country is a big challenge, and we are really passing through not many evolutions. So when we look into the key challenges, I thought in this few minutes, let me first start taking you that what kind of infrastructure the government has got and what priorities we are really moving into. Because this era is also coinciding with the close 5-year plan from the April 2012, which will go to March 2017. And this is a 5-year, very, very intensive and extensive planning phase we are there. Now let me look at it that we are 1.2 billion people, contributing to almost 80% of the global population after the China. And the country is big with 35 states and union territories. Number of states are rather bigger than even the countries. And then we have a federal system of very democratic nature and function. We do have at the moment, as to the current census of 2011, now we have around 653 districts in the country. And if you go down to the sub-district level, around 6,500 blocks, which are our administrative unit at the most critical level we have. And then if you go down, we have more than 640,000 villages in the country. Well, we are growing, country is growing. We were rural. Now today, almost 31% or more of that population has grown into an urban setting. Now this growth also brings not only the advancement and development, but also brings the key challenges also in terms of health and various other concerning sectors. So this is also a very important factor. Now the country has got a very well defined system of the healthcare delivery. After our independence, there was a different kind of need. The basic health or the primary health care was definitely an essential issue at that time. And that time, the whole committee, under his chairmanship, it has really done a very in-depth analysis of the health situation done in 1940s and in 47, 48, and then subsequently the whole committee report came out. And the whole committee report, even today, is so much valid that we have to really honor that. But to begin with, at that juncture, the whole committee said that you organize the healthcare right from the most peripheral level. And the concept was to create a primary health center, and down below each primary health center, we should have the sub-centers. And each sub-center to be managed by at least 2 trained, qualified, multi-purpose health workers, one male, one female. Because our female health or child health was always an issue then. Maternal mortality ratio, the child or infant mortality rate was very high for various reasons. So one worker, so-called auxiliary nurse midwife, was so dedicated for the health of the women and the children. And the male worker will take care of various other health issues, environment and sanitation aspects. Now at that juncture, we started one primary health center at the block level. That means for a population of about 80,000. But the dream of the board was that we must have a primary health center probably for a 5,000 population. And since then, the Government of India has been really going and moving ahead in this aspect to reach and outreach people with the quality of service. Of late, when we look into now the present condition, we have a primary health center for the population of 25 to 30,000 now. So from almost 80,000, we have definitely come to 25 to 30,000 in the plain areas, and for 20,000 or 15 to 20,000 per people in the difficult areas like hilly or tribal or the desert areas. It is the point where there is a doctor, it's the point where there is a lab, it's the point where there is a pharmacist. And then down below, we have the sub-centers, and today the health sub-center is for 5,000 people in the plain areas and for 3,000 people in the difficult areas. And then at each of these sub-centers, we have 2 workers. Now if I convert this number today, we have almost more than 148,000 sub-centers at the moment available in the country. And this is at the rate of 5,000 people. And we will move up, we have more than 24,000 primary health centers in the country. Now if I further go into that if 148,000 sub-centers are working in the country, if you can multiply it by 2, that means that is a large number of health workers. And for every of the 4, male or female, we have 1 supervisor. So if you can still go into, then you have still a large manpower. But then, right from Alma Ata days, Health for All, we always felt that we need a village level link worker. And if you recall, in 1970s, the village health guide scheme was started. Well, it went into a little bit kind of rough weather, but we have concretized. Today, the Government of India and the Ministry of Health has taken a very, very clear direction and decision that for every 1,000 population of our country, 1,000 not per village, every 1,000 we have 1 accredited social health activist, ASHA, accredited social health activist. And this person is a link person in the village. We have learned our lessons from the village health guide when we picked up anybody who can read and write, but we have become smarter. We have taken this ASHA only the women, and that too not the daughter of the village, it is the wife of the village. That means any lady who is coming after marriage to the village, she will be only entitled to become ASHA, because we know that in our culture, after marriage, she is not likely to leave the village. But the unmarried girl is likely to leave the village. So that is what we have taken the principle in ASHA. And let me share with you that at the moment we already have 840,000 ASHAs working in our country. Now, if I add these ASHAs, they are the link workers, they are real crucial people who have got liaison with the community, because they are one among the community and they link with the health workers. And this ASHA is really playing a crucial role. There is absolutely a mechanism of identifying them, training them, and giving them the responsibility. Now, in addition to that, in the village and under our ICDS scheme, because the nutrition was a very important issue in the Ministry of Women and Child Development, we have already established the Anganwadis. And again, the Anganwadi workers are there all over the country who are really taking care of the nutrition of the pregnant and nursing women and the under 5 children in our country, because that's one of the important issues. Now, when we move up, this is my peripheral healthcare infrastructure in the public sector which is available. I am not touching upon the various other healthcare providers who are coming. And let me touch that. And they are my colleagues, those who are in the private practice. And if I give you the number, well, it's difficult to tell the number of those who are practicing, but when we look into the registration of these qualified doctors with the Medical Council of India, we have got almost 900,000 doctors registered with Medical Council of India, MCI, which is a regulatory body. Of course, we don't have exact number, and that is again because we don't know that how many of them are really going into the practice, but large number of them are going. And let me just touch upon you at this point itself, because it's more relevant, that the government was very keen that how many of my public sector and private sector we have to work so closely. They are. There was no mechanism of regulating my private practitioners. But in the August 2010, the Government of India, our Parliament, has already passed the clinical establishment Regulation and Registration Act in August 2010. At the moment, that act is no doubt valid for the central government, all union territories, and 4 of the states which have joined. But this act is also requesting all the state governments to enact this similar act in their states also. And under this act, obviously, anybody who is to establish any medical practice, they have to register, and then standards need to be really created. So I think this is again going into a very big way is going to help in our large country. Well, I'm just moving up. After the primary health center, when we were earlier looking into the health of the woman, the emergency obstetric was an important reason for the mothers dying and the children also dying, high infant mortality. So the decision was taken that every block we established a community health center, which is a 20 beds unit with at least 3 to 4 specialists, including the gynecologist, a pediatrician, a surgeon, a physician, and then one who can manage the entire community health center, so a manager. So team of 5 of these people at community health center with other nursing and paramedicals. So aim is that every block should have it. But against 6,500 blocks, we do have around 4,800 such community health centers have already been established, and the government is moving very fast in further doing it. So that is another very important second kind of unit, which is becoming like the first referral unit at the peripheral level. And then we go up to a taluka level, we go up to the district. Every district has a district health organization with at least 100 beds hospital with the specialists. And there is a very well organized administration for the health through the district chief medical and health officer or to the district medical superintendent of the hospital. Now, if we have that large number of 653 such kind of units, above that we are going into the tertiary level at the state or regional and zonal level and super specialty, both in the public and the private sector. Now, this is the kind of large health care infrastructure is already existing in the public sector. And you're all aware that our country is big. There are a number of health care problems we have got the challenges. When we were independent, that time our large problem was on the communicable diseases. But with the development and advancement today, we are definitely facing our lifestyle diseases. So non-communicable diseases definitely have come up to a large extent. To such an extent that in our population, for example, if you take diabetes, I think we are going to have, I don't know, dubious distinction or good distinction that we are going to be the world capital of the diabetes. If you look into hypertension, it's again showing the age at which these diseases were occurring in my country was an average age of say 40, 45. Today it has come down even in the 20s we have that. So that is all indicating that we are also having the lifestyle challenges in the country. And for that purpose, besides various communicable disease programs, the government has also started a non-communicable disease program focusing on all these issues on prevention and management of the cardiovascular disease, the stroke, the diabetes, mental health, and the cancer. And this package is already started in the year 2010. But then we are expanding. Today, government has moved to implement this program in 100 districts in 20 or 21 states. But in a couple of years, by the end of this plan, we are definitely going to cover the entire country as a matter of fact. Now with these issues, if I really come back, I'll just summarize in a few minutes that what we have. But at each of these issues, we are definitely struggling with many, many challenges. The biggest challenge is my population control. With the way we are growing, every year one Australia is added to India. And with that kind of birth rate of 24 per thousand, we are really, it's a problem because that dilutes whatever efforts we make, it adds to a lot of challenge. At the same time, our life expectancy is definitely improving. It's definitely going. At the moment today, our life expectancy in birth for female is around 64 years plus, or for men, it is 63 years. It is just reverse. 20, 30 years back, my women of my country were dying earlier than the man. But today, it is definitely going a better trend because multiple pregnancies, early marriages, lot many complications, and the kind of differential treatment with our female was the real issue. But it's a good indicator that life expectancy of our women in India is now more than the man. That indicates that how the health and the empowerment and the care is being prioritized for the women in our country. Literacy rate is definitely going up. We are all reaching. But at the same time, we do have the problem of reaching to the people. Very hardcore area. This is a very big challenge for us. We have a challenge that our medical and paramedics, making them available at the peripheral level is a challenge. Because large number of our practitioners, they are concentrating in the urban area, which is 30%, but more than 70% of my medical and qualified paramedical fraternity is confined to a minority or 30% area. Now this is another big challenge that how we take people to the rural areas. Well, government is addressing. Government is addressing in terms of not only producing larger number of befitting medical and paramedics and the nursing staff, but at the same time, it also is struggling. They are not going to the periphery, or they are leaving they are leaving the country and going abroad. So this is another big challenge. You are all aware that government of India has been struggling with alternative strategies. Now to handle this, again we have, the government has taken a very important decision was that why don't we tap our own traditional systems of medicines. The Ayurveda was origin from our own country, which is good, safer, economic and better. And you know that in the Ministry of Health, a separate department of Ayush has been created, which is promoting Ayurveda, Unani, Siddha, homeopathy and all naturopathy. And if we really look into this aspect, so government is also creating the infrastructure for the practice of these pathies, and we are going, even the decision is taken that every primary health center should also have the option for placing one of the physicians from these pathies in that, so that people can use and take the benefit of our own systems, which are really quite better because complications or toxicities are much less in that as compared to our allopathic drugs. Besides this, the government is definitely taking the challenge of meeting the need of our, increasing need of our people. If we have to make one doctor for 1,000 population on an average, which of course at the moment we are probably one doctor for almost 1,600 people on an average, but practicing I don't know. So we have to make, the government of India is again taking a high lead in increasing the number of medical colleges to produce that. I recall when I passed out in 1974, my medical degree, we were hardly 93 colleges in the country. But today, we are 360 plus odd medical colleges. Large number of them are in the private sector. There are hardly 154 in the government and all remaining are. And that is again is an indication that how the government has really moved out to reach to the private sector. Because it is a fact that everyone have to be playing together. So the public-private partnership, public-public partnership, private-private partnership is definitely a big challenge to us. And I think we have to mobilize all those resources. I remember that time when we came out, I came out of the college, hardly 10,000 medical graduates used to come out. Today, we have almost 42,000 allopathy. And the number of my Ayush degree courses are still much more than that, 42,000. We are all thinking that how best we can really energize our existing system. For instance, number of our districts are so large. our district hospitals, number of them have more than 300 beds. So we are moving that instead of really opening new medical colleges separately, why can't we convert some of these districts and go into that? Now, dear friends, I can go on telling this, the quantum of the challenges we have. So the human resource is a big challenge. The challenge when I come back to the healthcare, my primary healthcare, but we have to also be prepared for my secondary and tertiary healthcare. We have to be prepared for various diagnostic issues. We have to be prepared for various issues relating to the providing the quality care and universal health care to each and everyone. Now the government of India definitely is encouraging that we should play a very close partnership all with all our colleagues. And not only within the country, we are open that all of Indians, those who have gone outside the country, even they have an opportunity to come back and serve the people of that. Now, example I can give that we have just come out of the 11th 5-year plan, which is finished on 31st March 2012, and from 1st April, we have already moved into the 12th 5-year plan. Now, the government definitely has realized and has made a commitment that our health expenditure was very, very low as per the need in the country. Only close to 1% of our GDP we were spending for the health of people. Whereas it has been realized that to the economic growth, the health and education are the two prime priorities which have to be given. And that is why the Commission, National Commission on Macroeconomics and Health now is giving. So government has really taken and also taken that by the 11th 5-year plan, they wanted that we should go to at least 2% of the GDP. But probably we have not achieved the idea. We have just 1.02 or 1.1% of GDP. Now, keeping that into view, when we are moving into the 12th 5-year plan, now a decision has been taken at the government level and at the planning commission level that the health has to be given a priority, the education has to be given. And that is why the 12th 5-year plan has been declared as a plan for the health. Now, when we look into the 11th 5-year plan, if I have to quote you the figures, my whole ministry allocation was 2.15 crores of rupees.
21,000 crores, sir. 21,000 crores.
No, it's more.
215,000.
215,657 crore was the budget of my 11th 5-year plan. Whereas now, though the 12th 5-year plan is not yet final, because the planning commission is still in the process, they have only allocated the budget for 2012 and 13 as an annual plan. But the Ministry of Health told we are going to have almost 4 lakh crores. I mean, it becomes like 2 lakh crores. That we are going to this 4 lakh crores. Now that is what the priority now the government has given for the health